right, so the question came in, what about these diabetic shoes? I know, for the longest time, diabetic shoes was like walking like Frankenstein. Do I have to have these whole huge orthopedic shoes that are clunky and heavy? Well, first of all, before we even have the conversation about the appearance of the shoes, we also need to talk about whether you even qualify for diabetic shoes. Some patients think that just by virtue of the fact that they have diabetes, that they get to have diabetic shoes or they need to have diabetic shoes. It's not really the case. It depends on how much circulation you have and how much feeling is in your foot. So if you have neuropathy, which is what is affecting the feeling, numbness, tingling, pins and needles, burning, aching, or cramping, that in conjunction with some sort of an orthopedic issue, some sort of like hammer toes or bunions, or maybe even like propensity to develop calluses frequently, there's several different things that need to occur before you would qualify to have diabetic shoes. And that's one thing that your podiatrist will be able to assess for you. When you come into Pueblo Ankle and Foot Care, we do not only x-rays on your first visit, but we also evaluate to see if there are any deformities, anything that could put you at high risk to develop a wound or an ulceration. That's really what the diabetic shoes are meant to be for, is to prevent those kinds of things from happening. You have a high risk of amputation if you then have an open wound that could develop into an infection that could require us having to do an amputation. So what we do is we have you come in, do this evaluation, and if you have any of those risk factors, then when we start talking about that you qualify for a diabetic shoe. And this is a women's shoe. You see it's fairly stylish. And this is a men's shoe. Again, I think this is something that I would wear. But what the difference is that with the men's shoe and the women's shoes, they have a removable insole to it that has multiple densities of something called plastizote in it. And what that does is it does form to your foot and helps to remove pressure away from certain areas of your foot. Again, with the women's shoe, same thing. The multi-density insert that's in there, what we do is we heat mold this. We get you 3 pairs of these, and that lasts you for 12 months. At which point then we reassess and see if you would qualify to get another pair done. But anyway, that's the short on diabetic shoes. Hope that's helpful, and keep the questions coming in. Also, please make sure that you go to our website and also to Facebook. Like us on Facebook, check out our reviews on Google. There's lots of good stuff out there that you can see how Pueblo Ankle and Foot Care is helping the community in Pueblo.